Welcome to the amazing knee pain relief class with the master bodyworker Sharon Sauer. Thank you all for attending. We have a great self-care protocol to teach you that any individual in the world, no matter what your background, can use to fix just about every knee pain that comes in to the office. You can likely prevent most needs for invasive procedures and also increase and improve your function. If you're an athlete and want to get better at whatever athletic you're doing, you can do that. If you're a person who wants to get out of pain, you can do that. Just about every condition Sharon has treated and successfully eliminated with this protocol. So first, we'll introduce you to Sharon Sauer, and then we will go over each of the muscles briefly and all the muscles that can cause pain in the knee, and then we will proceed immediately onto this awesome protocol that you can do no matter how much of a lay person or professional you are. And from there, afterwards, we'll move on to the in-depth evaluations for those of you who are professionals that need to do this in office on your patients. Okay, so with no further ado, here is Sharon Sauer, our teacher of the amazing knee pain relief class.
Hi! Good to see you. So welcome to everybody who's all my family and friends, and all to the professionals that hopefully we got them to come over from our NSCA Periscope Live broadcast area.
Yeah, we apologize for technical difficulty last week.
We had some technical difficulties last week, and I think a lot of people did because
everyone did.
Because we're using an iPhone to broadcast, and everyone went to the new operating system, and everyone had to do everything, and no one could get on last week.
They promised successful transition by next week. Next week we'll be back to our usual NSCA channel.
Hopefully.
Yeah, hopefully. Let's keep our fingers crossed.
Most likely. So today we're going to do both last week's and this week's program.
Awesome.
We're going to do Protocol 25, Protocol 26, Protocol 27, and 28. So you can download those and have them available for your use and for your friends' use and or for your patients' use. So let me show you what those protocols. So here's the Rosetta Stone of myofascial pain and dysfunction, and we're going to look at some of the areas that cause front of the knee pain, inside of the knee pain, outside of the knee pain, and back of the knee pain. So we're going to be doing all that. So let me point them out to you. So here's the muscles here. So we're going to take a look at, here's the knee pain. So here's the whole body. So the front of the knee pain is 26. The outside of the knee pain is 25. And the inside of the knee pain is 28. And 27 is on the back. Okay, and that's 27. And let's take a look at the muscles that can cause back of the knee pain. So here, I'm going to give you a different light because somehow you're getting really dark there. Yeah.
I think it's the monitor.
Okay, so here we go. So posterior knee pain, the most likely one on is the gastrocnemius, okay? And that could be affected by nerve roots S1 and 2. And there's the range of motion test that we can do for gastrocnemius. Here we got the biceps femoris, that's one of our hamstrings. The popliteus, a little muscle behind the knee. Also two more hamstrings, the soleus and the plantaris. So these are all the muscles that cause back of the knee pain. Let's take a look at the front. The most likely one that causes front of the knee pain is rectus femoris. That's the muscle in the front. And then the vastus medialis, the adductor longus and brevis. The lateral one only has one muscle, Justin.
Yeah. That's a quadricep on the outside called the vastus lateralis.
Now that's a quadricep. Now that's also, we're going to treat a little ligament that causes pain on the outside as well.
Excellent.
And then medial knee pain, so pain on the inside of the knee, would be the muscle there, the vastus medialis, gracilis, rectus femoris, sartorius, and adductor longus.
It's a lot of fancy names.
Yeah, well.
Why don't we look at them? Can we see these muscles?
Let's go look at them.
All right, let's go look at them.
Okay, so let's take a look at the most likely one, rectus femoris. Okay. So we'll find it on our chart here. So how's it look on our chart there, Justin?
Rectus femoris.
So look at the trigger point is way high up here in the hip. See where it is right there?
Yep.
And it causes really bad pain deep underneath the kneecap. So it really feels like, oh man, if you have this pain, you think, oh, I need to have a knee replacement.
This little muscle attaching
Right here.
up here.
See, it attaches right there on the
right
pelvis.
down the center of the front of the thigh.
And it attaches right onto the kneecap, and then
Wow.
it attaches onto the tibia, the muscle, the bone right below the knee. So that's where it attaches, and it can even pull and make that little part of the knee grow. So that's the vastus femoris.
Yep.
I meant rectus femoris. Next, we're going to look at vastus medialis, and it's most likely the second most likely one to cause pain. And you can see trigger points real near the knee and the middle, and up a little higher will cause it to be pretty painful here in the medial side of the.
So that's like the quadricep that's along the inside.
That's it. That's it right here. Yes, that's it right there.
Right.
Then the next one that we're going to be looking at is the lateralis. So this would be the quadricep that's right here. So this is your quadricep.
That runs down the whole side of the thigh.
And you kind of use that for both, like a hamstring and also as a quadricep. And you see it causes really bad back of the knee pain. Right here, two different views of that, and sort of the side of the knee pain. It also comes under and kind of causes pain underneath the kneecap right there, and can cause some pain here in the hip.
A lot of people have that, right?
Yeah.
Because of their foot dropping in and pronating.
That's right.
That
So
causes...
from hyperpronation, frequently this muscle gets really tight and hard.
Yeah.
So, but in addition, another muscle can give you a lot of trouble. The vastus medialis over here, because it gets overstretched. This one here gets shortened.
Yeah.
This one here gets overstretched along with the sartorius and some of the other muscles. So sartorius is also a muscle that is like the sixth most likely to cause pain in the knee. And it comes across, starting way high up here, and then comes across all the way to the inside of the knee. So that's our sartorius, and it causes a little bit of the inside of the knee pain and mid-thigh and upper thigh pain. The fourth most likely to cause knee pain would be the adductors, brevis and longus. So that's right here, so it attaches right here in the front of the pelvis. And so we can get that when we're treating the vastus, as we're treating the quads, we can get that. And you can see it causes inside of the knee pain, and sometimes comes down over the front of your bone here. So this is an important one. Now, what about some of the ones that cause back of the knee pain? Oh, gracilis, we didn't go over that, but I didn't see it right there either.
Okay.
We'll look at that a little bit later. So gastrocnemius is the most likely one to cause back of the knee pain. So let's take a look at the gastrocnemius. So let's.
The gastrics are those big calf muscles that everybody who works out shows off. They look like those two big round bulbous muscles in the back of the thigh you can see on a runner or a bicyclist.
Now it's very likely to also cause plantar fasciitis. So this is a muscle that causes back of the knee pain and could cause plantar fasciitis. Could cause you to feel pain all through the back of the knee there. So that's the most likely one to cause back of the knee pain. The next one is biceps femoris, so that'd be our hamstring.
Another hamstring muscle.
So let's take a look at our biceps here. So here's our biceps, and it causes really pretty bad back of the knee pain. And you frequently could get that from driving. So a lot of us could be getting pain through here from sitting at our desk and from driving. So this is the semitendinosus and membranosus, the inside of these muscles right here. They could cause buttocks pain, but also come down and cause pain. But this vastus lateralis causes a lot more outside back of the knee pain.
Or the biceps femoris. So
I
thought biceps
femoris.
I thought biceps was in the arm.
Oh yeah, right. This is in the leg.
There's a biceps in the back of your leg?
Yeah, that's it.
Wow,
We do. We have it right there. So this is our biceps.
Why is it called biceps? Oh, because it's got two heads.
That's it. It's got two heads.
It's got two heads, and it doesn't show it here, but there's a head that goes up this way too.
It's right
here
there.
it is.
It's right there.
Yeah, under there.
Yeah.
Goes up that way and up here. So that's like when you reach behind your thigh and you grab hold of your side of your thigh there, the back hamstring that's on the outer side.
Right.
That's the biceps femoris, just like the biceps in your arm. And then when you grab the hamstring that's kind of in the medial side, in the inner back of the thigh, that's a group called the tendinosus and membranosus. And the tendinosus is like a thinner cord that sits on top of a flatter. It's like a hot dog in a bun. The semimembranosus is like the bun underneath it, and the tendinosus lies over the top. And the tendinosus has that tendon that goes down around here, and it can feel real tender when you touch the inside of your knee.
So I call that tendinitis of the pes anserinus.
Yeah, it's called the pes anserinus. Yeah, good.
Okay, so here's the popliteus, and see that muscle there is right in the back of the knee, and it causes pain right there in the back of the knee.
Oh,
and
yeah.
here's our gracilis. It causes a little bit of inside of the knee pain, but it mostly causes the pain higher up.
And the popliteus muscle, is that the one that's responsible for locking and unlocking the knee?
It is, and if you're having trouble locking and unlocking, this could be your muscle. Let's treat that, and let's do a little stretch for it.
Yeah, if people get a frozen knee and their knee like locks or it won't lock, right? That's what that little muscle, that's what it does. It twists the knee slightly as you extend all the way. It gives a little twist to unlock it and lock it, and that's what it's necessary for.
Now the last one here we're going to talk about is the soleus and the plantaris.
Okay.
So here's the soleus, and it makes up more of the ankle. So whereas the gastrocnemius makes up the two big sections on the back of the calf, this makes up more of the ankle. And you can see that it can cause pain in the back of the knee. This higher section here can cause pain here in the back of the knee.
So it's like underneath and deeper than the gastrocs.
That's right.
So
it's below
you see the bulky gastrocs in a muscular person, but underneath it, kind of flatter and down toward the lower part, is where you see the a bad muscle to have pain, and it really causes a lot of problems, right? I mean,
right.
Yeah.
And the plantaris
A lot of heel problems.
will also be causing us pain in the back of the knee.
Okay, plantaris. Yeah.
Okay, so
So those are the muscles.
So that's
but we want to know how to get rid of the pain.
Right. So we thought we would go ahead and show everybody how to do self-care.
Yeah, let's do it.
So if everyone could get some tools.
Yeah.
So if you can get a rolling pin, if you could get a jack knobber, a back knobber, a tennis ball, and a bigger ball, or a big foam roller. So those are the things you should be getting.
Can you show us what they look like? I think we have them out on the table there.
We do have them.
All right, let's go out to our self-care, modified self-care waiting room.
We forgot to say one thing.
What thing?
We could have nerve root compression that could be activating everything at L2 to S3, and we're going to do some self-care with that. So here's L2, and all the way to here to S3. You can see that could be causing L3 and 4 could causing knee pain, and you can see the S1 and 2 could be here causing this back of the knee pain.
The dummy translation for that is that all the muscles that go down the lower part of the leg that affect the knee, every muscle, it is plugged in by nerves in your spine, right? And
here.
all the nerves that go to those muscles plug in the lumbar spine.
And
the sacrum, yeah. And all those little nerves that come out in these areas are necessary to be free and fully functioning, or otherwise the muscles will have problems. So if there's any compressions in the spine, if you have some disc problems or things like that, but more often than not, the little muscles that hold the spine together and cause it to wiggle and twist and move every time you walk and bend, those muscles can cause problems with the nerves that go all the way down to the muscles that affect your knee. So lumbar spine and your knee are connected nervous system-wise.
Okay, so here...
wow, look at those tools. All right.
I got that.
These are the protocols you can print off at myopain.com.
So these are the things that we're going to do. So here's protocol 25. So this is the outside of the knee pain, and this is the area we'll be treating. And then here's some things that we'll be using, some tools. We'll be using the jack knobber, the back knobber, one of the balls, and the foam roller. So this is how we'll be treating it. We can treat it seated or on the floor. So some of us will be seated, and some of us will be on the floor. And then here's some good stretches.
If it seems like a little too hard for you, there are peel backs that are easier. So you can always make it easier or always advance it a little bit.
Here's protocol 26. This is for front of the knee pain. And here's our muscles that cause front of the knee pain. So it's all in pictures for you. So easy.
Yeah.
And then here's your stretches. So here on this one, 27, this is causing pain in the back. And here's all the picture of all the muscles that cause that pain. And again, here's the things that we'll be doing to fix it. And
How long does each one of these protocols take, Sharon?
Well, you could just do them maybe if you have front of the knee pain, maybe you could do it 20 minutes twice a day and see. But that's, well, it depends on, okay, well, you know what? How fast do you want to get rid of the pain?
Oh, I see. So more is faster.
Yeah. So what if you want to get rid of it today?
Well, then you might just work until it's gone.
You might. Okay.
Yeah.
so it just depends, you know. But
Okay.
a nice. But often when people come in, I often say, you know, start with 20 minutes a day. But you know, some people might do it 4 times that day.
And generally, there's like a formula for treatment, right? It starts with heat.
Yes. So we put heat. So we can introduce some of our guests.
Okay.
So tell us your name.
Sally.
Sally's
Sally.
here.
Thank
and
you, Sally.
we're heating Sally's legs up a little bit with the heating pad.
Right.
And we also have with Kirk here.
Kirk.
And
There you
also,
go.
and he's got a little heat there.
He's
and
got
also,
a moist heating pack called a Fomentech bag.
Yeah, we can put it underneath you or on top.
Yeah, you could even sit on that. They're very sturdy. Or sitting in
And
a
here we
bath or a
have-
hot shower would
Here
be
we have
really good.
Camille, and she's putting a little hot water on her knees there, and she could also sit on that one. And here we have Stephanie, and she's got a little hot water here too.
Fantastic.
So often we use heat, then we do compression. So here we have the compression, and after that, then we do the heat, then we do the compression, and then we do the movement.
So heat, compress, and move. And
That's
why,
it.
Why is pushing on the little knots in the muscles, why is that so important? I don't understand. Can't you just stretch or work out? Or I mean, why do we have to push on these painful knots in the muscles?
So if it's painful, and or if you don't pass the range of motion test, probably you have tissue that's dysfunctional. If you stretch, probably everything will stretch but this dysfunctional tissue. And if you strengthen, probably everything will strengthen but the dysfunctional tissue. So if you treat the tissue before stretching and strengthening, then you'll make all the tissue available. Anything doesn't pass the range of motion test, well then hopefully you'll be able to use those muscles then after you treated them and get them to pass.
Yeah.
So then they'll be able to do stretching and they'll be able to do strengthening.
And those little knots, whether you feel it or not, those little knots are sending horrendous amounts of negative signals to your nervous system.
Yes.
They're like little knots in your muscles, and they're screaming at your nervous system and causing the nervous system to have all sorts of funny reactions. Might make the leg weaker than it should be. It might cause one to be tight and short and the other to be long. And it can cause all sorts of problems that will affect the health of your joints, over the long run in ways you couldn't believe.
It's so important.
Yeah.
Well, I mean, how important is your knees?
Yeah.
You know?
I mean, you need
it's
it.
so important. And every day I'm so happy because my knees work.
Yeah.
I just go on to myself about, I just love my knees, and I just love the way they're working, and I just love how they can do everything.
Yeah.
So it makes me so happy. To run. I just ran down 14 flights of stairs, and so it was just fun to do.
Yeah.
And the knees feel good. Doesn't it feel good when you can use them?
Yeah.
So, and how do you feel when you can't use them?
Yeah. Oh, disabled, depressed, kind of.
Yeah, and you can't. Yeah. Oh, and by the way, about half the men that are unemployed are on pain relievers.
Oh, I see. So in other words, we might be able to get back to work too.
That's right. We might be able to get back to work.
All right.
All right. So let's take a look at treating ourselves. So
How about some of the tools?
Oh, let's look at our tools first.
Yeah.
Okay, so we have a few tools here. There's something we can correct our underlying perpetuating factor, which is first metatarsal deficits. This is one of our important ones. Here we've got this nice stretching strap we get from OPTP, stretch out strap. We have a couple mile buffers here. And we've got tennis balls, which is a great tool for treating the hamstrings, while you're seated. So it can be incredible while you're on airplanes or when you're in a car or at your desk. Jack knobbers, we can use those on the wall or on the floor. And then these are some of my favorite tools. These tiger tails are absolutely great for treating.
It's like a rolling pin, right?
It's like a roll. Yes. So all of you that don't have a tiger tail, you could use your rolling pins that you haven't used for a long time.
All right. So these are the ones we're going to be using to treat our muscles. So,
and here another one we can use is our
yeah.
back knobber. So it's a good one for treating the spinal roots, and also it's good for treating the back of the hamstrings and the inside and so forth of the quads.
Okay.
So it's a nice one, lateral quads as well. Woo.
Great.
Oh, we didn't talk about that, so we've got
and somebody wanted some attention.
Yeah.
We have a big foam roller.
and then we got some really soft balls for people that can't stand the pressure, and a little bit harder balls for also treating our quads.
All right.
So we've got a lot of things to get done today. Okay, good. Okay, so we're going to start with the hamstrings and the gastrocnemius, soleus, and the popliteus, and the plantaris, and get those treated in the back of the leg first.
So we're going to work in the back of the knee pain first.
Yeah.
So this begins the self-care protocol that if you're a practitioner, you can do this with your patient and teach your patient to do this.
That's right.
And
So-
if you're a layperson, you can do this yourself or with your friends or loved ones and get better healthy knees on your own.
Yes, what if you could fix your knee pain?
Oh.
Wouldn't that be incredible?
It's not the first time.
Some people that came in to visit me There was told that they had to have total knee replacements, and after working with me, they were climbing Mount Olympus.
Wow.
Can you imagine?
You had a patient to climb Mount Olympus after being told they had knee replacement.
Yep, totally.
Wow.
Isn't it incredible?
Yeah, incredible.
And I've got some people who are even all the way in their 90s that had bone on bone.
Oh yeah.
And we fixed all the muscles, and it's like they have a well-oiled machine. They're passing all the range of motion tests at 90.
Wow.
Can you imagine?
I've seen it.
And they're walking. So, and they couldn't walk. Their goal was to be able to walk without pain.
Yeah.
They're definitely walking without pain now.
So your knees don't have to wear out before you do.
That's right.
No reason to.
Okay, so I'm going to give everybody here today protocol 27 to use. And so we're going to you can take that home with you. So here's protocol 27. And here you go. You can have that. And here you go. And I guess I don't need one. And 26. Okay, so here we go. All right, we'll put that over here. Okay, so first we're going to start with, we're going to treat the gastrocnemius and the hamstrings, and we'll come in here, we'll treat the popliteus, the plantaris, and the back here, the leg here, it's soleus, all right?
Okay, great. So back of the thigh, back of the calf, and then back behind the knee.
Back behind the knee, yeah.
Perfect.
So I'm going to put a little heat under my leg, and I'm going to see who else wants to sit on the floor.
Okay.
You want to sit on the floor?
Do we need another chair, or we have enough? Do we need one more chair?
Can I have the big one? The big one. Okay. Good. Okay, so I'm going to put the hot water bottle, this is a nice foam and tech bag, on the floor.
Any kind of a moist heating surface works really well.
But it would work fine.
Yep.
And if you could give me a pen and a highlighter, that would be great too. Oh, yeah, great, super. Okay, so we have two different kinds of back knobbers. Stephanie has one kind here. So we're warming up our leg here.
Okay,
Give
great.
you a nice warm up. And so could you give me the stretching strap? Thanks, Camille. So you could have a stretching strap for you. So here we're going to go ahead and take a look at treating the soleus and the gastrocnemius. So we're going to come like this. Great, super. And you know what? If I could have I like this metal one. I like the metal one. Okay, the reason I like the metal one, Justice, because I can reach more. See how that's big?
Yeah.
And I can reach places.
So these can be purchased at pressurepositive.com, or you can get them from a trigger point therapist in your area, of course.
Yeah. So here we're going to be treating the back of the leg. So here I've got this tool and coming underneath here like this. So this is one great way, and it hardly, how much pressure are you putting on, Stephanie?
Light.
Very light pressure, and it presses in good enough, even with light pressure. So are you able to reach those spots on yourself?
Sure.
Okay, great. How are you doing over there, Kirk? So he's getting in there, so now let's move up from there. So we're going to go and we're going to look for painful spots. If it's not painful, probably we're going to move on to another spot.
And how long do you hold it if you find a painful, tight
You're going to hold
spot?
it for at least 2 breaths.
Okay.
But you can hold it longer, but at least 2 breaths.
So
Okay.
we're doing the gastrocs and the soleus?
That's right. So do you have protocol 27?
Yes, I do.
Okay, good. So we're going to cover we're going to go on the inside of the calf right here. So we're going on the inside. Let me show you where I am. So here I am on the inside. And I like this tool because you can pull it like this and treat the inside of the calf right here. So this is a really important area that causes back of the knee pain.
And you'll show us if we didn't have that tool how to do it with other tools, right?
I'm going to show. I'm
Okay,
definitely going to
good.
show it.
Yeah, good.
I'm definitely going to show. So here, I like it because it's so easy.
Yeah.
And we're going to come.
It's kind of something everyone should have. This tool right here is just one of these double S hooks is just so good for improving the quality of your life.
So now I'm going to keep coming up, and now we're going to come up and go on the inside of the thigh here, all the way up to your sit bone.
Okay.
So here we're going to come right here. So I'm on the back of the leg.
Yep.
And I'm going to come right here and press right onto the semitendinosus and membranosus, or the hamstrings in the back of the leg.
Yeah, those are the hamstrings on the inner back of the thigh.
And I'm going to come a little higher. And the inner back of the thigh.
Yep, inner back of the thigh.
The inner back of the thigh. And this all causes back of the knee pain.
Yeah. Yep.
Now, what could cause these muscles, the hamstrings, to give us trouble? Our teacher, Dr. Tervel, called them the chair seat victims.
Sitting, in other words.
Yes, in other words, those that sit the most will get this problem.
Yeah, I think tight
So-
hamstrings is almost a guarantee for anyone in the modern
Now you
workplace.
can also, you can feel if you can put it a little bit more on the stretch,
Huh.
you're gonna feel the taut bands, and you can get right on them.
So you can lean
So
forward, you
lean
mean?
forward, and if you can
Ah.
bring your toes towards your nose, you'll be
Okay.
stretching the gastrocnemius, the soleus, and the fascia going all the way up to the hamstring.
Wow.
So we're coming on up.
Yeah, one of the great secrets to being effective with this work is using the stretch.
Could you give me the jack number? Yeah, thanks. Okay, thank you. Camille.
Stretching while compressing is so important because the stretch is what we call a macro stretch. It stretches the full length of the muscle, and the little tool that's compressing and spreading apart the little muscle fibers, that's called a micro stretch. So you get the micro and the macro stretch at the same time. That's really the only way to truly stretch a muscle. If you forget the micro stretch, then those knots stay tight and shortened, and the other parts lengthen even sometimes more than they're supposed to. And then you can overstretch certain parts of the muscle while still leaving the tight, taut bands unaffected.
So here we did the inside of the lower leg, and then we came up and did the inside of the thigh.
Yep.
So usually what I do is I highlight that, and then I draw the tool that I used to treat that area.
Great.
So now we're going to do this part of the thigh here, and I'm going to use this jack tool. So I'll put a little picture of a jack there,
Just to mix it up.
and then I'll put, also we're going to do this section with the jack. So then I'll just go ahead and show that to everyone, and then point that I'm going to be treating that area. And then we'll also be treating the back of the knee. And we could use either tool for that purpose.
Okay, great.
So now I'm going to come here on the outside, and
All right.
to balance my foot on that, it probably would, if you took a little strap or a piece of fabric or something like a rope, you could keep your foot in the right position for doing this. So for here, so here I'm looking for, so here's our soleus. Right here, we're going to press right on it. So we're looking for a painful spot. Well, maybe straighten my foot out there. And then we're going to come up a little higher. So oh, that wasn't painful. So we're going to look for another spot. Oh, that wasn't painful. So let's look for another spot. Well, there's a painful spot. So I'm going to hold on to that for a few breaths. So breathing and relaxing. And if you stretch it at the same time that you're treating it, you're encouraging the lengthening. So
Yeah.
that's one thing, but also you may want to treat it on the stretch because sometimes it's less painful. So that could be another reason. And when you put it on the stretch, the taut bands stick out. So if you're pulling like this and you see some bands sticking out, bands of muscle sticking out, then you know, oh, those are the tight ones. So I might as well get right on those. So here again, I'm right here on the. Now we're here on the outside hamstring, the outside of the back of the leg.
Sharon,
Yes.
I don't have one of those, so I'm using the wall.
Look at how
You
you're
do
doing
that.
it. Yeah. So she's using the wall. You can say, Camille. So she's got
The wall.
herself to the edge of the chair. So she's doing what I'm doing, but she's doing it on a chair, and she's stretching the back of her foot using the wall. Very
Great.
good. Excellent.
Yep, you can be innovative and creative
That's right.
while you're doing your self-care. There's nothing
That's
wrong
right.
with
You can, and I like it when you do that.
that. Yeah.
Yeah. So here we're coming on up, and we're looking for painful spots. We're going towards the bone that you sit on. If you're sitting on the edge of a chair, so we're going towards that's where all the hamstrings attach. So right there. Well, not all, but most of them do.
Yeah.
Well, all three of them, but the biceps also attaches a little lower over here on the thigh. So we keep coming on up, and we just got that when we went there. So there we go. So then after we do that, I'm going to give it a little massage and massage all the areas that we just treated. Super. So, Jessica, do you think you could give me protocol 26?
Yep.
Thank you.
So that was the
Okay.
back of the thigh, right?
That's
How
the
hard
back
was
of the
that?
thigh.
You just
How hard was
treated
that?
you just treated all the muscles that could cause pain in the back of your knee.
Well, I was gonna do a little bit more with,
sorry.
with right behind the knee.
Okay.
But
Oh yeah, we didn't do right behind the knee.
yeah, we'll do that. But I was gonna jump over to, so that's these two. So we'll do this in a minute.
Okay.
So
we'll get
here
back
we're
to
gonna
that.
go ahead and do the front of the knee.
Okay, this would be a lot of muscles in the front of the thigh.
So this would be the rectus femoris. This is the muscle right here in the front of the thigh.
Okay.
Then also the adductor here,
On the inner part of the thigh.
right there on the inner part of the thigh, and the medial, the quadricep right here that goes to the inside of the knee.
Yeah, the adductors are the ones that close your legs like this.
Right, that's the adductors does this,
Adductors, yep.
right, and the rectus femoris extends the knee like
Yeah.
that.
Yeah, exactly.
Okay, and so let's go ahead and let's take a look at those muscles. So, and then we'll go do the back of the knee in a minute. Okay, so we'll start with the rectus femoris, and I'm going to highlight that one, and then we'll highlight this one next. Okay, so let's go ahead and we'll treat that, I think, with our back knobber. I mean, our jack knobber, I meant to say. So I'll make a little drawing of that. Okay, so for this, remember the most important spot is way up here. So you find this bony part here. And let's go a little lower down where the leg bends, and then like a couple fingers down there, and that's the spot that causes really bad achy knee pain.
Way up
Really
there
bad.
causes achy knee pain down there.
That's right, and look where it is. It's right where we bend when we're sitting.
Yeah.
Okay, so right at the spot that we bend when we're sitting can cause really bad knee pain. Isn't that crazy?
And they found
And-
this out by injecting chemicals, irritating chemicals, into that spot and
Right.
watching where people had pain. And
Right. So they did it like a distribution graph. They did like 100 people, and they injected and they found that when they injected just about there, it caused a really painful referred pain into the knee and deep into the knee underneath the kneecap.
So you could go into your doctor with this kind of terrible knee pain, and it could
Well-
be as easy as fixing something, trigger point way up the top.
Right up here. Right
Wow.
here. Yeah.
Wow.
So let's go ahead and let's we can go ahead and get your tool and look for a little painful spot, and let's see if you can find one. Look around up here for a painful spot.
Okay.
And I think I found a little bit of a painful spot. So let's go ahead and we'll press on that.
Okay. Great.
So we'll just go ahead and breathe and relax. How you doing, Camille?
Doing good, finding spots.
So let's go. Do the rectus femoris. Let's go a little bit more anterior, a little bit more anterior, a little bit more anterior, a little more. Yeah, right there.
Oh, okay.
Yeah. So we're gonna get right in there. So we're gonna go. For this, you could have the leg bent. Okay. So yeah, because then it's sort of stretching your rectus femoris, but at least the part of it. Okay, and then we're gonna come down a little bit more inferior. And look for a painful spot.
Uh-huh.
Then come down a little bit more inferior. Looking for a painful spot. And a little bit more inferior.
So we
A little
were
bit more
asking, we
inferior.
were asked about doing this on the stretch.
Yes, we can do it on the stretch. Let's do it. I'll do it on the stretch in a second then. Okay.
We've got a little bit of stretch because the knee is straight.
Well, it's not stretched so much here. No,
Right.
we can
I mean,
definitely-
it's not stretched, right?
Yeah,
'cause
it's
the
not
knee's-
stretched,
Yeah,
yeah.
exactly. It's not
It's not
stretched.
stretched, yeah.
Sorry.
So
Camille was doing it on the
I'm
stretch
doing
because
it
she
on
has
the
it.
stretch.
She has
now,
the knee bent
okay,
in.
now Camille's doing it on the stretch.
Yeah.
That's definitely a stretch.
Yep.
So if you can, how's it feel? Can you reach it?
Mhm.
Okay, great.
Sure.
Also, if your knee is bent in a chair, you'll be treating it on the stretch.
Yeah.
Okay.
So
But
bending
if
the
you're
knee
like-
helps, and also bringing, because this quadricep crosses the hip joint, extending the leg backward extending the hip backward, kind of like Camille. Camille, if you were to bring your knee back even further to stretch the hip, or if you were to sit up straight a little bit more,
Okay, there you
And
go.
that could extend that, extending the hip back and bending the knee. Exactly, Jeff. That would be an awesome way to stretch that. Thank you.
What Jeff is that?
I don't know which Jeff it was. It was Jeff.
Hi, Joe.
Hi,
Hey, Jeff. Thanks for your question.
So look at here. So here we'll have part of the rectus stretch,
Yeah.
and part of the vastus, and part of the medialis. So the quadriceps are stretched to a certain degree in this position.
Yes.
So here we can do the vastus medialis. So here we already did the rectus here, straight down the middle. Now let's go ahead. We'll do this medial part here. So it goes to the inside of the knee, and then of course this ends up attaching right there, and then comes up here on the femur. Okay, so let's go ahead and we'll treat this one on the stretch. How's that?
Yeah, exactly.
So let's go ahead and we'll put it right here. So this is a good way, but there's lots of other ways to treat it on the stretch as well.
Oh, it was another master bodyworker, Jeff Denton. Yes.
Great.
Yeah. He finished Sharon's whole course, in fact.
That's right. That's right.
Yeah.
He knows about treating on the stretch.
Oh yeah. He was bringing it to light. It is so important to stretch.
So here, I'll lean back a little bit to stretch it a little bit here,
Yeah.
so we get a little bit of stretch.
Yeah. Remember
So this
that
is
the
more-
vastus doesn't cross the hips, so it's not. You could just keep the knee bent. But for the rectus femoris, it'd be good to do a little knee, like thigh extension too.
Yeah, that'd be good.
Yeah.
And also the lateralis we could treat in this position as well. And like usually I use one hand, but I let the other hand help that hand. So I have two hands doing the work of one hand,
Yeah.
where you might normally use one hand like this.
Right.
So it's a good way. So looking for painful spots. And then usually we go ahead and massage it a little bit afterwards.
And if you have a lot of trouble with these muscles, you might always think, do I maybe have that short, metatarsal deficit, whereas my big toe is a little bit too high up off the ground and shorter than my second toe. And we'll talk later about how to fix that, because that's the most important thing to do when you're having a lot of problems in the knees, to make sure that you do not have what they call Morton's foot, which you can read about at mortonsfoot.com.
Now these two muscles here, the adductors, can cause pain in the knee and the medial, and also down right over the bone here. So it can cause you to have pain throughout the lower leg as well. So here's your adductor. Let's go up and feel our femur, feel our bone right there, and we're going to press into the adductor right here, right on the bone, and then we're going to go towards the pelvis right here.
Okay.
So here we're going to come down and press in, looking for a painful spot.
Yeah.
See if you find something painful. Has anyone found anything painful?
Anybody finding painful spots there?
So when we find a painful spot or a hard spot, frequently it's filled with painful chemicals, and sometimes you could just call it just painful chemicals, or you sometimes could know what chemicals they are, but you could just sensitizing painful chemicals is maybe adequate. So here, we come up a little higher, so we're here, and then right here, so we're going to press right in.
Yep, and remember, one of those little adductor muscles, the magnus, actually can cause problems up into the pelvis.
Yes, not the longus of the brevis,
with the magnus,
but the magnus does. That's correct. So
it can cause all sorts of problems, even in the genital areas and things like
it's
that.
incredible.
So it's a good muscle to make sure it's functioning well.
now, so I've had knee pain here. So I've been living on a second floor where I have to in a house that had 2 stairways, and the second, my knees were not in the greatest shape. If they got a little bit short, then you could just feel this excruciating knee pain, and it really feels like you need a knee replacement. It really does. But a lot of times you can fix it up just by treating it right then. Or maybe sometimes I get disappointed because I treated once or twice and it doesn't go away, and then I have to double down and say, I got to treat it every day till it's gone. So and then sometimes I'm pain free for years, and
And you have full function.
and full function. I can use the keys to do everything. So it's so exciting.
Yeah, you really only need a knee replacement every few months anyway.
Okay, so a lot of times when you have your knee straight, you could move it around and see, does it move to the outside? Does it move to the inside? Does it go up? Does it go down? So you could feel, does it move? So if it doesn't move this way, then these muscles are probably too tight. If it doesn't move that way, then probably this muscle's too tight. If it doesn't go down, maybe all of them are too tight. Okay? So it's good to check that and see if it could twist like this. Now, if it can't twist like that, sometimes it's the deepest muscle that's underneath those quads. It's the deepest quad.
I see.
The intermedius. So we want to make sure all of those muscles are all those different motions we have in the kneecap. Now, if the kneecap the high riding kneecap is the most likely cause of knee pain. So it's like if these muscles are too tight, they pull the kneecap up. And then when you try to kneel or step down or get in and out of a chair, you'll have significant knee pain, or walking will have significant front of the knee pain.
Got it.
Yeah, and of course sitting gives you significant back of the knee pain. Yeah. So what about those little muscles on the back of the knee? Okay, so those would be good to treat as well.
Okay.
So let's go ahead and for those, let's take a look here. So, I highlighted these. So these are the ones we just treated, the adductors. And here we also did those. Okay. And then again, for those of you who can use this as a reference, this is this is the stretches that we do for those, and we'll do those next. So here we're going to do the diamond, and we're going to do the snake. Okay. So here, this will get a lot of muscles in the back of the knee. The diamond and the snake. So here I've got my hot water bottle underneath there, so it's sort of babying it, you know. Okay, so we're going to go in the back of the knee, and for this, you're going to have to visualize what I'm doing, because you're not going to be able to exactly see it, but you're going to. So I'm going to start with the diamond. So for here, I'm going to go down to the bottom point of the diamond, right there, and press in. So this is I'm below the knee. Oh yeah, sorry. Right there. Then I'm going to come up a little bit to the inside, towards the inside of the knee. So I'm starting right here. So I just did here. Now I'm going right there. Now I'm going to come up right here. So this is about this spot right there. Then we're going to come up a little higher on the just above the knee. That's right here. Then we're going to come up a little higher. Now we're at the top point of the diamond, right there. So let's see if we can find any painful spots. What do you guys think?
Yeah.
We found a couple painful spots, okay. Then here we're going to go down the outside. So we're through the outside part here. So here, there it is right there. And then we're going to come a little further down. Oops. Right here. And then a little further down, a little further down. So here, when you're getting through here, we're getting the top part of the gastrocnemius, and we're getting the popliteus and the plantaris.
Yeah, there are two little muscles back in there, and also there's a lot of attachments from the hamstrings.
That's right.
And the gastrocs.
That's correct.
Things all
Yes.
in there.
So to make sure we get all of those attachments, we're going to do the S shape now.
Nice.
So this is the S shape. So just by doing the diamond and the S, we're making sure that we get all the attachments in the back of the knee. So for the S, we're going to start a few fingers below the knee. So let's go 3 fingers below the knee, and we're going to start on the inside. So we'll start like so my picture starts on the outside. So we'll start on the outside. So we'll go here. So we'll start right here on the outside. We'll go across below the knee, and then across the middle of the knee, and then above the knee.
Okay.
So here we go. So we're going to get the gastrocnemius, a little bit of the soleus. Looking for painful spots. Turn to the inside a little bit to get to the inside parts. Now we're going to go up. And we'll go right to the middle of the knee, and we're going to go across the back of the knee. Right across the back of the knee, looking for painful spots. And then let's go a few fingers above the knee. We're going to go across, looking for painful spots above the knee. And this is what you're going to want to train your friends to be able to do, your children to be able to do, your parents, and everyone you know, they can learn to fix their own knee pain. Okay, so we're going to give it a nice massage.
Approximately how far, Sharon, above and below the knee?
I would go with about 3 fingers above and 3 fingers below.
Great.
Yeah, approximately, yeah. So give it a nice massage. So another tool to use in the same, to treat the back of the knee, a great tool would be the back knopper. So you could go ahead and use that behind your other knee. And so again, you could put the leg down. We could go the bottom part of the point of the diamond. So you can go like this and get right on the bottom of the diamond. Let's go up the inside, and let's go. And when you use this tool, you're able to really get in underneath better. Don't you think, Kurt? You can get under the a little better? Yeah.
Yeah.
So I like using the back knobber. What do you think?
It stabilizes it a little bit better.
Yeah, so she likes it better too. Stephanie likes it better.
Yeah, just the pressure.
Yes, you can address the pressure better. Good point. Excellent point. And you can
Plus, I couldn't reach with the other.
right. I like these because you can reach with them all over the back knobbers. Yeah, I like reaching. Okay, let's go down the other side, doing the diamond on the outside of the knee. Coming right to the outside of the knee. Coming a little bit lower. And a little bit lower. And I didn't find very many painful spots, but if I did, I would have stopped for a few breaths. So that was good. Not too painful. That was good. It wasn't very painful.
Yeah, don't be disappointed.
Okay, now I'm going to start a few fingers above the knee on the outside, and I'm going to press and go straight across. Breathing
Is this
and
still the
relaxing.
diamond or the S?
The S. I meant
Okay.
to. I could have said. We're coming across, so you could use, like I like using the S hook, the back knobber, quite a bit. Stephanie, show them what's something really good about the one you're using is that it comes apart. So this one comes apart. That's too hard.
No. Perfect.
Good. It came apart. So that's a nice tool to take with you in a bag. Whereas this one is a conversation starter.
Will they let you on the airplane with that one?
Well, I'm
Most
always
likely this one.
I always wonder about that. So I always put this in my this one I put in my carry-on bag, and the other one. No, this is the one I check.
You check
Right,
it.
you have to
And
check that
and then the
one.
one Stephanie's using, and Camille, and Sally, and Kirk is using that one I take on in my carry-on.
Yeah, the one you're using is called the Big Bend.
Yeah, this is called the Big Bend. You have to order that kind of special. But it's nice. I like it. It's one of my favorite ones. Well, that other one's my favorite one too, because then I can take it around with me easier. So they both are my favorites. Okay, so here we're getting right into the inside lower section on the bottom part of the snake. So again, we'll give it a nice massage. Give it a nice massage after we treated it. And then so I can review a little bit what we did. We treated the front of the leg here, and we treated the right way up here. We treated the rectus femoris and one of the quads, and that muscle causes really bad pain right here. Then we also treated the vastus medialis, and it causes pain more on the medial side of the knee. And we treated the vastus lateralis, but we're going to treat the vastus lateralis a little bit more.
Yeah, we didn't really treat that one too much yet.
Well, we treated just a little section of it, but there's a lot more of the vastus that we could treat.
Yes.
So I thought we would do that next.
Yes, sounds great.
So we have a few different ways to do that.
This muscle is the bane of many people's existence.
It is.
It's a horribly
It
painful
is.
muscle.
Okay, so we could go ahead and treat that again. One way we can treat it is laying on our side, and we could get the tool underneath us, and we could really look for some painful spots. But sometimes if your leg is on the hot water bottle, it doesn't hurt as much.
Yeah.
Now, one of the reasons for that is heat, cold, deep pressure, and light pressure, and scratching all go to the brain faster than the pain message. Oh, if you can give me the vastus lateralis one.
So we are now going to
Yeah, thank you.
protocol 25.
25. You give me 25.
Anybody else need 25?
Give everybody 25.
All right.
Okay, so here's 25. So here's our greater trochanter, and here's our vastus lateralis, and we're going to look at the whole outside of the thigh. And you can see that, and also, you remember this is the amazing knee pain relief program. Okay, we're going to treat the vastus lateralis, and here's a bunch of different ways to do it, and we'll do several of those ways. So we can do it with the jack knobber, with the back knobber, with the tennis ball, or with this larger ball, or with one of these foam rollers. So we've got a lot of different ways we can do it. So I was going to start with putting my Vastus lateralis on this hot water bottle, and at the same time I'm going to be treating it with the back down. So I'm going to come close to the outside of the leg here, and I'm just going to go ahead, and this is so easy. You could listen to music or talk to your friends, and you know, it's just easy to do. And let's come up a little, so go straight up the side, press in.
We're finding some tender spots here.
Oh my, yes.
Now these tender spots can be very tender. There could be so many different reasons for having them, but for one could be that we have first metatarsal deficit, so that would be one reason. But there's of course a lot of reasons.
Yeah, Morton's foot.
Yeah, Morton's foot.
When you have Morton's foot, your big toe is not as long as it should be, and you have to, in your second toe, you have to bend kind of over it to get pressure onto your big toe, and it causes your ankles to roll in, and all the muscles on the outer part of your thigh and calf to stretch or contract too much, and they become riddled with a lot of sensitive trigger points.
So, but one of the things is the first toe doesn't touch the ground.
Yeah.
And so, because of that, you turn your foot out. So how many of you in our viewing audience turn your feet out while you walk?
Oh yeah.
So that's really important. So often you're turning your feet out because you're trying to get your big toe onto the ground, and then you're making these muscles on the outside of the leg tighter for that reason as well. So there's much more reasons besides that.
Yeah.
Okay, so when you find a painful spot, you're going to press on it, breathe, and relax. And so, have you found any painful spots, Kirk?
Oh yeah, about 5.
Okay, good. He found a few. And how about Stephanie?
You should see her expressions. I'm
Yes,
watching them. She's got one.
Okay, so let's take a look at the vastus lateralis on the other side. And for that, let's use one of our other tools. So Stephanie, you could use this. See if you like that. So you could use a really hard ball, much harder than this, and you could also use a really soft ball like this. So this would be like, oh, it's so painful, I can't stand it. So you could start, or you could use something harder, like a nice foam roller, like this.
Can I use the tennis ball on the wall?
You may, but you may do it that way. That'd be great. That'd be super great to do it that way. So here we can do it this way. So let's go ahead and let's do the other leg, and let's go ahead and do your vastus lateralis this way. So let's go ahead. Let's looking for painful spots.
We had a couple questions about flat feet. We're going to cover a little bit more about that, but you, when your ankles roll in, it's not as frequently a problem of flat feet as it is that your first toe is a little bit elevated off the ground when your ankles are neutral. So your ankle has to roll inward to get the first toe onto the ground. We'll show you how to evaluate that. We'll have you stand with your ankle like this, get the ankle neutral, and you'll see that your first toe is slightly up off the ground. That's called a first metatarsal deficit, or what we call Morton's foot. It looks just like that. When the person is with their ankle neutral, their foot is slightly off the ground. When they bend their knees, then the knees kind of buckle in, and that is very easy to fix. All you do is you get a little lift that goes under your toe. This is an insole that has the lift, or you could get just a little lift itself that you could tape onto your shoe, inside your shoe, and there's a picture of a lift. See, it's a little bit thicker under the toe, and that causes your ankle not to have to roll in to get onto the floor. Instead of where it would normally have to roll in, the ankle would roll in, it's slightly propped up so the ankle can stay in neutral. That is one of the greatest fixes, so cheap, and it can really change your life. So, it's worth trying out for sure. And if you should be looking for a trigger point therapist in your area if you're a patient, and if you're a therapist, you should go to mortonsfoot.com and get in touch with the people there and have them send you an evaluation kit. Okay? They're called Posture Dynamics. Is the company.
Okay, so another way to do it is we can use a nice foam roller, but then you have to use your hands.
Well, especially with one that thick. That's a pretty thick one.
This is a thick one.
They don't. Many are thinner than this.
Yeah, you can get up and get right where it attaches onto the greater trochanter.
You're welcome.
Then come on down. And come on down, look for painful spots. You can roll forward and back, looking for those painful spots.
Yeah, I love the foam roller. It's my favorite.
And another way to use the foam roller is you can also treat the anterior leg at the same time while you're stretching it. So you could go ahead and get on the anterior leg and at the same time stretch it.
Yeah.
So, and you can use your, okay, so those are good. So, why
the
don't
foam
we...
roller is good on carpet and usually a little thinner one. Because when they're that thick and especially on a hard floor, they roll a lot.
Yeah, that's a lot, big rolling one there. Yeah, the same. Yeah, same. Yeah. Okay, so this is a good tool as well. You could sometimes go ahead and use this for treating your adductors. So you can get the balls on the inside of your leg here, and then you could go ahead and treat your adductors with the ball like this. So these are good.
Inside of your thigh,
the inside of your thigh like that. Okay, so next we're going to do movement. Okay.
Oh, and what about just maybe show them how to use the tiger tail if they were to have one of those?
Okay, I'd love to show. I absolutely love to show how to use the tiger tail.
Yeah, exactly.
Okay.
This is the rolling pin.
This is the rolling pin. Okay. So suppose so let's use that for a stretching tool of the chair. So bring it out to the middle. So sometimes, okay, so you get up in the morning and you're gonna go down your stairs and go, oh, I can't believe how painful my knee is. So you can get out your tiger tail and put all your quads, lower part of your quads on the stretch. And you could go ahead and look for painful spots this way and press on it and go here and let's go right on the patella tendon and right where all the quads attach onto the tibia. On the inside, up here, your sartorius, your gracilis. You come on up here, you can treat your adductors.
Yeah.
And we can do our hamstrings. So we can do them either on the short, like this, or while we're stretching it. So we could go like this, treat them while we're stretching them. So they're enhancing the stretch. Get behind the knee. Get all the way behind the knee. And I like to do the soleus and the gastrocnemius.
Stretch.
So this one here, we're stretching the soleus.
Yeah.
So we get like this. Get right on that soleus, right on the soleus, right on the soleus. Let's treat the vastus lateralis. Let's get one part of the tool here, one here. Then we're going to treat that vastus lateralis, the outside quad.
Yeah.
Get right on that. So this is a great way. And then I also like to just use the end of it, and I use that sometimes to treat, like we're using the back knobber or the jack knobber.
Yeah.
So it's a good tool like that as well. And it reaches up high like this if you want to get at your adductors.
Yeah. Great.
Another muscle that would reach really good would be the gracilis. So you can get the gracilis really nice like this.
Yeah.
Looking for those taut bands.
Excellent.
Okay, so I love the tiger tail, and they come little short ones, a little bit longer and a little bit longer. So they're great to use.
Okay, so step one was that you heated the area of the thigh and calf that you wanted to work on.
You could take a shower or a bath, or you could use a hot water bottle.
Yep. Okay, step two was you went through each of these protocols, and wherever there was a little X, you pressed and felt whether it was taut and tender, and when you found one, that's a trigger point, and you compress that with moderately comfortable but good firm pressure for 2 full breaths and release, and maybe did that a couple times until it relaxed, and then you moved on until you covered the full length of the muscle. So you did that muscle, you did the anterior knee, those were your quadricep muscles, and your adductor and all that. Then you did the middle of the knee, the inner thigh, all your adductors in there. Then you did your lateral thigh, and you did the back of the thigh. And when you've gone through all those points, covered every one of those little X's, which really doesn't take very long at all. You can see how fast Sharon just did it with the roller. When you've gotten all the compression done, you want to get the muscle moving again.
Right.
So now we add movement, stretching and movement.
So we're gonna move. So one thing we can do is move with a little bit of music. So we're gonna pull up a little bit. We'll put a little bit of music out. But let's all of us. Kirk, if I could have you, and Camille, if I could have you to work. Yeah.
This is good.
Okay, so we're gonna do. Let's take a look at the hamstrings. So we're gonna go side to side. So first we go side, 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 side. Come on down, down, down. And up, 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 up. Good, good. Okay. So that's good for the adductors, for the hamstrings. Okay. So let's go ahead and we're gonna go. So touch your waist. Then we're gonna touch our knees. Then come back up. Touch towards one knee and up and down. Bend your knees. Bend your knees. And come up. And go down. Good. Other side. Touch your waist. And come on down and up. Come on down a little bit more and up. And come on down a little bit more. Good. Okay, so we're gonna go ahead and stretch the gastrocnemius and the gastrocnemius. Okay, listen to the beat. Go and listen. Good. And left. And right. Good. And left. And right. Good. Okay, so we're going to go ahead and come on down and up and down a little bit more and up and down a little bit more and up. Okay, good. So let's go ahead and let's walk. Turn your toes in. Turn them out and in and out and in and out. So we're going to stand with it like this. Then we're going to twist and out and twist and out and twist and out and twist. Other leg from this position. Twist. And we're going to stretch our quads. So let's go ahead and you're going to take it back like that. Give it a good stretch. And bring it up towards your chest. And up towards your chest. And take it back. Other leg. So let's go ahead. Let's go ahead and stretch it. Bring it up towards your chest. Take it and stretch it. And back. Good. And march. Toes in, toes out. Now a good way to get your soleus, that's a stretch, so is to encourage the squat. Imagine that. So suppose you're gonna do the squat and you go, oh, I can't go any deeper than here. Okay? So then you're gonna go feel where it's tight, see if it's here. Look around. Oh, now I can go a little further down. So then you go here. And then you come further down. And then you come all the way down. And you're looking for whatever's stopping you from going down. So that's a good encouragement. Okay, so you can kind of use music. And you can come in and you can do your knees, kind of move at the same time. So this will get your hamstrings, gastrocnemius. Let's do one at a time. Okay, what do you think?
Well,
we did it.
The only other thing we could do is where all the nerve roots come out and the lumbar spine.
We didn't do it yet. Okay.
Now, how about the nerves that feed all of those muscles that you just treated, you heated, treated, and stretched?
Okay, so we're going to take a look at L2. So we'll here's S1, L5. So we'll go up here to L2, 3, 4, 5, S1, and 2.
Which means we're just going to be treating
the little muscles along the spine.
all along both sides of that spine.
Yeah.
Okay,
so we're going to treat the little tiny ones that do the rotating.
Yeah.
So these here that do the rotating, and also some of the ones that do a little bit of the extending.
Yeah.
Right along the spine.
Great. And
So
we could do that with music and movement too.
We could.
Yeah.
Okay, so what are some different ways we could do it? We could treat it with a little tiny ball right along the spine.
Yep.
So one way to do it, so you guys could pull out a little bit bigger ball, but you could go ahead and you could find, let's find L1, S1, L5. Let's go there first.
It's like down by the base when your sacrum starts, where toward the bottom of your spine is, right at the bottom of the spine.
Sacrum starts.
Yep.
You get right there. We get right up there. We'll go up and down.
You roll up and down
Then we'll
along
go
the
side to
sides of the
side.
spine, and then side to side.
And look for a little painful spot.
Yeah.
Let's go a little higher. Let's go on the one side of the spine.
Good.
And we'll go all the way up to L2. And we'll look for any painful spots.
This is great for low back pain too.
Mm-hmm. Oh yeah.
This is just phenomenal for low back pain.
So when you find a painful spot, you're going to press on it, breathe, and relax.
If you have low back pain or knee pain, you should do this at least 2 or 3 times a day. It only takes a minute, and it makes sure that
we
you're...
did it on one side.
Yep.
Now we're going to go on to the other side. So we'll start here. We'll
Yep.
go up, and then we'll go down. So we're going to go...
Tennis ball is good too, absolutely. Find a ball that has the, the diameter and also the hardness that you like.
So we'll go ahead on the left side, look for a painful spot. And when you find a painful spot, you're going to hold it, breathe and relax, and go a little higher. And let's go down over the sacrum. So here we're going to go over the part that's below your low back.
Yep.
Just above your tailbone. We're going to go there and look for some painful spots there. If you find a painful spot, you're going to hold it, breathe and relax.
You can even bend forward a little bit while you're doing it too to get more stretch there.
Yep, you can get right on it.
Yep.
And you could press on it, and you could rotate a little bit.
Yep,
and
rotate
forward. Yeah.
and bend forward, exactly. Okay.
So those will be all great ways to treat it. Sometimes I put something, I do this on my back knobbers and jack knobbers, and also on my tiger tail. And sometimes then I also will use that and have that press in on the sacrum or the QL or other muscles as well.
Or if you have one of the curly cues, the jack knob or back knobber, you can wrap around. This is nice because you can do it lying down.
Here's a nice curly cue.
Yeah. If you're doing it lying down, this is really nice.
So if let's try it laying down.
Okay, let's try it laying.
So laying down can work really good. So I'll try that.
Let's say you're sore, you don't want to get out of bed quite yet. You're cuddling with your little kid or your dog.
You do it. So this is a great way to get. So you're going to get underneath, and then when it's so easy to do.
Oh yeah.
So you're going to put it underneath you, press your back down, then you're going to pull it to the opposite side.
There you go.
And look around for painful spots. So you find the L5, they go up to L2.
So the lumbar spine starts where the last rib is and goes down all the way until the sacrum, and then your, coccyx, your tailbone,
And let's go across to the other
Start
side.
the sacrum all the way up. Yep, you could have it on the same side, or you could have it curve around and be on the other side.
Yeah, I like it. For this, I like it on the other to go across because I want to get in that little groove between the spinous process and the transverse process. And usually, if you look at how hard I'm pressing, I'm not using very much pressure, so it's very easy to do when you're laying down. So you don't have to use hardly any effort. Now we're going to go all over on top of the sacrum, all over that part that's above your tailbone, below your low back.
Exactly, right there. Yeah.
And look around for painful spots. Well, I find a lot of people with painful spots on this part.
It's all right. It's like a triangle shape, like my hand. Right there.
Great.
That about wraps it up. This is
We did it. Okay, so for that part,
Yeah,
we'll want to move the pelvis.
yeah.
So if we could have the music one more time.
One more time. Cue it up.
Okay. Camille, you could help me with this.
Sure.
Okay. Here. Okay, so for this, we're gonna do the pelvis under and bend, and under and bend.
Everybody
so bend
needs
your
this.
knees under
Everybody needs
and
this.
back, and under and back, and side to the right, side to the left, side to the right, side to the left. So we're gonna do forward for 4, forward, 2, 3, 4 to the right, 1, 2, 3, 4 to the back, 1, 2, 3, 4 to the other side, 1, 2, 3, 4 to front, 1, 2 to the side, 1, 2 to the back, 1, 2 to the side, 1, 2. Well,
That's it.
that's the amazing knee pain relief program.
Now you're gonna focus on the spots that are most relevant to your condition. You know, where you're finding tender spots, where you're going to focus more time. But you have been shown how to cover all the parts that could cause problems in your knees, and you have been shown how to treat everything that could prevent knee replacements, surgeries of any kind, injections, narcotics, anything that most people might expect as they get older to have to do to keep walking and using their knees. You've been shown how to avoid all that.